As Pfizer and Moderna vaccines make their way to healthcare workers and long-term care facilities, there's still questions about those
So
vaccines.
let's bring in Dr. Jeff Pothof with the UW Health System. He joins us now. Dr. Pothof, thank you very much for joining us. We just mentioned that fewer people are getting tested because they think the vaccine is here. It's now becoming available. It feels like we've been running a marathon and ultra marathon here with the virus. How much longer should we be getting tested with these vaccines now approaching?
Right. I think it's really easy to be reassured by the good news of the vaccine and think that COVID-19 is over or winding down. And unfortunately, that's not the case yet. So, right now, individuals who have really any symptoms that could be COVID-19 would benefit from a test. This will identify whether you have the disease, helps set off contact tracing, keeps you from getting other people sick. So for the next several months, if people do have symptoms of COVID-19, it would be best if they got a test.
And Dr. Potter, for those who are worried about getting that vaccine, because there still are people out there, can you walk us through the process of how it works? We know you took it, and if it's safe.
Yeah, I think a lot of people are worried about the vaccine with the speed that it was developed. They think, boy, something must have been wrong there. And really, when we look at it, the technology used in this vaccine has been around for about 10 years. There was tremendous investment of resources, and then all the world scientists working on it together is what resulted in the quick turnaround. The studies, reviewed by independent groups, this vaccine does look to be very safe and far more effective than we thought it could be. So really, from healthcare professionals, not a lot of hesitation in recommending this, not only to our patients, but to our family members.
Dr. Pothof, there's been concern of how the virus now has maybe mutated. We're hearing stories out of the UK about this. How concerned are you about this? Should we be alarmed? And if it's mutated in the UK, is it here already as well?
Yeah, the mutated virus in the UK and South Africa has made a lot of news waves. This is what we expect viruses to do. They're very good at mutating, and they do this because they're trying to find a way to survive. More effective transmission makes them more likely to survive. Now, the good news is these mutations are small. It makes it more likely that you could catch the disease, doesn't make it more likely that you'll get severe disease. And as far as we can tell, it looks like vaccines will be effective against this mutated strain.
That's an important note there that you said
Yes.
just at the end there. So the vaccine should work. Dr. Pothof, thank you very much.
Thank you.